No. Hello, everyone. I'm Dr. Farah Ingale, Senior Consultant Physician, Diabetologist, and Director, Internal Medicine, Fortis Hospital, Vashi. Today, on the occasion of World's AIDS Day, I'll be giving you a little information in general about HIV and AIDS. So, what is HIV? HIV is an infection which is caused by an HIV virus, which is human immunodeficiency virus. Now, this virus attacks those cells of the body which, in fact, helps us fight infections and keep us safe. Now, when the virus attacks those cells, then naturally you will be prone to catch new infections. And in HIV, your immunity gets affected, because of which, when you acquire infections, it becomes more serious compared to those people who do not have HIV infection. Now, in the early initial stages, when the patient is not symptomatic, when the viral load is not that high, means the illness is not that serious, it is HIV infection. But when the infection becomes serious, then it gets into the AIDS mode. Okay, AIDS means acquired immune deficiency syndrome. In this, when is it diagnosed? Like when we do some tests to diagnose how severe is the illness. So when the CD4 count, which is one of the tests we see or do to assess the severity, when the CD4 count comes down to less than 200, normally which is between 500 to 1600, it is called as the severe illness or AIDS. Now, AIDS or the HIV infection is one such infection which can affect your body from top to down. Every system of your body can get affected. It actually can affect your brain, it can affect your heart, it can affect your gastrointestinal system, it can affect your genitourinary system, your rheumatological system, and cutaneous system, even your eyes. All systems of your body can get affected by AIDS. So, how would you know that a person is suffering from AIDS? Certain symptoms would be there, like patient may feel very may feel too weak, may feel lethargic. There may be symptoms of weakness, arthralgia, myalgia. There can be diarrhea, persistent loose stools. There can be cough, cold, and other problems. And these patients, because their immune system is weak, they can catch up many other infections. Like, for example, they can catch up opportunistic infections, which could be any bacterial infection, viral infection, protozoal infection, or fungal infection. And as I've told you, these infections can take a serious turn in these patients. And then there is one entity called pneumocystis carinii pneumonia, which happens to many of the patients who have AIDS, and even the eye involvement with cytomegalovirus, and so many other infections can happen in this AIDS because of the HIV virus. So, how would you diagnose? There are certain tests which we do to diagnose AIDS or HIV. That is the blood test which we do. One is the PCR test, which you can actually, with this PCR test, you can detect AIDS little earlier. Then we have the ELISA test and we have the Western blot test. And as I've told you, that infections which they catch up easily and can be very serious. One of it is very common infection is tuberculosis. Now, tuberculosis in a patient with HIV, the ranges and the test we do, like for example, if we do a MAN2 test, to diagnose tuberculosis, normally we take that test positive when it is more than 10 millimeter, that is the induration erythema. But in HIV, if it is more than 5, we take it as positive. So certain other tests also we should do if the patient is symptomatic. Like we have to do an X-ray, we have to do regular blood test, because even the bone marrow is affected in AIDS and there is suppression of the bone marrow. Then the counts may come low, and then we have to do the liver function test. If the liver is affected, then cardiac involvement can happen, so we may have to do an ECG and other tests. If there is a neurological involvement, we may have to do the scans. These are all the tests, like support diagnostic test and supporting test as per the symptoms the patient has. Nowadays, actually, we have very good drugs available for treatment of AIDS, that is called as antiretroviral drugs, and combination of drugs can also be used, and we get good results with these drugs. We have patients who have been taking these drugs for about 20, 25 years or more, and they're doing really good. They are like as good as a normal person. Only thing is, you have to take the medicines, you have to keep on doing the test from time to time. Like you have to check for the CD4, CD8 count and the viral loads. Maybe if it is under control every 6 months, if you're symptomatic, maybe little earlier. If you take all the precautions and if you take the medicines, you can remain healthy for a long time. And now is about the stigma associated with AIDS. Now, people think that sitting with the patient who is infected with HIV virus could be dangerous because from there also you can catch up infection, which is not the case. Sitting with the patient, eating together with the patient will not transmit the infection to you. So do not alienate them. It should not be a stigma for them. This infection is transmitted by parental route, that is, by sexual transmission when there is unprotected sex. And multiple sexual partners, the chances of acquiring the infection is more. It can be transmitted via blood transfusion directly. It can even be transmitted by a prick of an infected needle when the needle has been used in a positive patient, or by the body fluids. So, how to prevent? We have to be careful. So, you have to avoid sexual contact with those people who are positive. So, unprotected sex is actually dangerous. And also, you have to actually avoid contact with the blood and other body fluids of infected patients. And sitting together with those people will not get you infected. So, that you have to know. And up till now, there is no vaccine available. So, proper habits, keeping your immunity intact, and getting yourself checked in case if you have symptoms or if someone close to you have HIV infection, go for the medical help and get yourself tested. That will help you. So that is all from my side. Thank you so much.